Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Nigeria Center for Disease Control, NCDC, confirms 5 cases of coronavirus in Cross River State. Government doctors in Infectious Diseases Hospital, Ondo State, withdraw their services following failure of government to accede to their demands. And 5 million residents to return to stay-at-home restrictions for 6 weeks after a surge in cases in the Australian state of Victoria. Now, West Africa recorded over 85,000 cases of COVID-19 with 34,899 active cases, while Nigeria has confirmed 29,286 of them. In the region, 49,561 have recovered. Nigeria with the highest number at 11,828. But Ghana, the second highest in the region, has discharged 16,069 patients, even though it is the second highest with cases at 21,077. The Nigeria Center for Disease Control puts Nigeria's death toll at 654, even though total samples tested are now over 150,000. Of the new cases, 575, Lagos has 123, the FCT 100, Delta 58, Edo 52, Ogun 42, Katsina 24, Bayelsa 23, Rivers 22, Borno 19, Plateau and Ondo 18 each, Oyo 17, Kwara 15, Osun 13, Enugu State 9, Nasarawa 7, Abia 6, Cross River 5, Kaduna 3 and Ekiti 1. The states with the highest cases in each region are Lagos in the southwest with 11,367. The FCT in the north central has 2,281 cases. Kano in the northwest with 1,268 cases. Edo State leads in the south-south with 1,435 cases. It's the third highest in Nigeria, and Borno tops in the northeast with 547 cases. Ebonyi still leads in the southeast with 503 cases. The Nigeria Center for Disease Control, NCDC, confirmed 5 cases of coronavirus in Cross River State. The 5 infections are part of the 575 new cases recorded in 19 states and the Federal Capital Territory last night. Before now, Cross River was the only state in Nigeria without any confirmed case of COVID-19. However, it appears that the 5 cases were the ones earlier reported in the state by the University of Calabar Teaching Hospital, UCTH Calabar. Cross River State officially completes the list of states in Nigeria with confirmed cases of COVID-19. And medical doctors and other health officials at the Infectious Diseases Hospital in Ondo State have withdrawn their services. The health workers under the National Association of Government General Medical and Dental Practitioners, Ondo State, withdrew their services following failure of government to their demands. Now, the medical workers are asking for a better welfare package, including life insurance for frontline doctors who are in the IDH. They have also been complaining of inadequate supply of personal protective equipment, PPEs, to aid their work and attend to patients at hospitals. According to the Secretary of the Association, Dr. Tunde Olashakinju, it is a difficult decision for them, but it is important that members withdraw their services due to what they call the lack of human face expected from the government. Dr. Billy Usani is an internal and public health physician. He joins us here in Lagos. Glad you could join us on the program.
Thank you for having me.
Okay, I'd like to start with what we're seeing in Cross River State, yes. Finally recording 5 cases. Why did it take, the NCDC this long? Because, there have been several issues coming from Cross River State and then, the NCDC.
That is quite amazing. And to be honest with you, what I know at the moment is also what we all heard in the news lately. I really wonder why it took that long for them to record cases. It's a good thing that the the health workers at the University of Calabar Teaching Hospital were able to come up quickly and raise the alarm for why, the NCDC had not even reported any cases throughout Cross River State. Yeah, so at this moment, I wouldn't really know exactly why it took them so long when most of the states in Nigeria had actually reported cases. So I'm sure there's something it needs to be looked into. It's something that needs investigating.
Another thing that comes to mind is, don't you think that the state has lost more time in terms of contact tracing of those who are already infected? Because, it kept insisting for quite some time that it didn't have COVID-19.
Obviously. And sometimes that's what makes it a little bit more dangerous. You see, sometimes when you deny the fact that you have an issue, you lose time, to be able to react, to make sure that you have preventive measures in place.
In Ondo State, we have doctors withdrawing their services, and these are doctors where cases of COVID-19 are being managed in the state.
Yes.
And this is not the first time.
Yes.
We've been having doctors, even in Lagos, medical doctors, complaining about welfare, complaining about, insurance, complaining about PPEs.
Yeah. So, so that brings to mind why we now regard our health system as a very fragile system. Because if you look at the pillars of health systems, one of the major pillars of health systems are health, health financing and human resources for health. And that financing needs to be available to take care of the healthcare workers who are frontline, who are there to deal with the problem. And recently we've heard that the Federal Ministry of Health had approved a good remuneration package for healthcare workers, especially in terms of call duty allowances, hazard allowances, and all of that. But I think there's probably still an issue in the time lag it would take for them to implement those things. So I think there has to be room for discussion between the healthcare workers and the authorities.
And perhaps a little bit more in the state's response.
In the state's response, exactly.
Workers.
Exactly.
So tell us, with regards to, the virus spread in Nigeria, how are we doing?
I would say in comparison to the other parts of the world where the virus has gone haywire, we're doing quite well. But that's not to say that we should rest on our oars. And that's because I realized that we probably learned very good lessons from our approach to the Ebola outbreak. So the response that we had was quite immediate, and then we were able to get things under control. So generally speaking, we've done quite well, but it still remains that our health systems, our systems are fragile, you understand? And so we need to depend more on preventive approaches than trying to take on the virus head on.
So if you were to advise Nigerians now, what should they be doing?
So this is the time for people to actually change their behavior. You need to take personal responsibility. The health and safety measures that have been recommended by all of the authorities, the WHO, the CDC, are very clear. The Presidential Task Force for COVID has said it, try and avoid crowds. If you don't have any reason to make contact with people, avoid it. If you have to be in a crowded place or make contact with people, wear a mask or wear a face covering, and all of those things. Make sure your hands are clean all the time. Wash your hands. Keep a physical distance, and all of that stuff. And I'll also like to add that by way of personal responsibility, we need to make sure that we're also keeping our health, in tip-top shape, so that our immune systems, which are the basic defense systems that are built into our bodies, can help us overcome, the virus in case we get infected.
All right, we appreciate your time. Thank you so much, Dr. Billy Usani, internal and public health physician. Thank you for joining us on the program.
Thank you for having me.
Now, ahead of school reopening, a group in the Northeast Regional Initiative has donated textbooks and furniture to the only secondary school in Kanama community, that's in Yobe State. The school, which was shut down years ago as a result of the Boko Haram insurgency, reopened this year, but academic activities were again hampered by the pandemic. Receiving the items, the representative, the Commissioner for Education in the state, thanked the group for the donation, charging parents to change their attitude and send their wards to school.
In all our secondary schools in the states, we do not have this kind of equipment they supplied and the items we found here. We are very grateful and we appreciate their effort, and we wish they will continue to assist other secondary schools too. On the other hand, the issue of attendance, school attendance by our members, particularly that of Kanama, who are provided with a lot of materials, instructional materials and office equipments. I solicit from the parents that they should endeavor to send their children to school, because it is not possible if you have the materials but you don't have the personnel to be taught in the school. We have the attitude generally in Kanuri area that most of our people do not want to send their children to school. But this time was different, we believe.
Now, COVID-19 was first identified as a cluster of pneumonia cases caused by a new coronavirus. Doctors have since learned that it's a respiratory disease, one that especially reaches into your respiratory tract, which includes your lungs. We have Dr. David Ajibade. He's a general practitioner, executive director, Brain and Body Foundation. He joins us on the program from our Abuja studios. I'd like to thank you for joining us at this time.
Thanks for having me.
All right. First, how does COVID-19 affect one's lungs? What is the impact of that virus on one's lungs?
Well, like you said, it's primarily a respiratory virus. It attacks the respiratory system. So it starts with the upper respiratory tract, the nose, the throat, and then further down. And that's why people lose their smell. That's why you have sore throat. For most people, it stops there. Now, in certain conditions, especially a weak immune system and other issues, it gets down into the lungs, specifically attacking the alveoli cells. The alveoli are like bags, bags of gas, where the exchange happens between the blood vessels and the lung cells. So the oxygen gets into the blood vessels, carbon dioxide goes back in. The virus attacks that part specifically. And that's where the trouble starts, because it sets up a whole host of things. The body reacts to that, causing more damage. And in fact, most of the damage and most of the deaths we're seeing in COVID-19 is not really because of the direct effect of the virus itself on the lungs specifically and on the rest of the body, but because of what is triggered or ignited by the presence of the virus and the activity of the virus in the body. So that's why it's so dangerous to it, because it attacks the parts where gas exchange actually occurs.
We have talked about, and this is healthcare practitioners, the importance of vitamin D. Now, is there any evidence that shows for persons infected with COVID-19 are likely to die if they have vitamin D deficiency?
Well, actually, there's a lot. Just recently, we saw one from Indonesia by scientists and doctors there that showed that there's an alarming percentage of those who had insufficiency or deficiency of vitamin D, and that's when the vitamin D levels in your blood are below 20 nanograms, or there it is, 20 nanograms per mil. So that is what they're finding out. And interestingly enough, I mean, we started looking at this for a while. I mean, we were looking at vitamin D when we were working with children with sickle cell disease, for instance. We found out that, well, we're trying to look for something that was safe and was effective for boosting the immune system. And we started working with that, and we saw results with that. But then when this whole COVID-19 thing started, we started saying, okay, where does vitamin D fit? And we started hearing stories all over the world about how vitamin D can actually help. And so, like you see on the screen there, it says it's almost 99% of cases who had very, very low levels of vitamin D are most likely not to survive the ICU and to eventually succumb to the disease. So to some extent, we're seeing, and we're not saying that vitamin D is the whole story behind COVID-19, but it's being duplicated around the world, in the US and the UK, where they're seeing they're seeing that black people are sometimes as much as 4 times as likely to die from COVID-19. And they are beginning to look at vitamin D as a possible factor there. And in fact, I believe it was Tyler Perry, the actor, who came out on Instagram and was really shouting to black people, please take your vitamin D. It seems like vitamin D plays a huge role in this.
Okay. I was just going to quickly ask, if you can, in 20 seconds, tell us how to know if we're getting enough vitamin D and where we can get that.
Well, bottom line, if you're not in the sun for an hour a day with most of your body exposed, you can take it to the bank that you're not getting enough vitamin D. So my suggestion is that you supplement with vitamin D. And it's available in the pharmacies everywhere now, I believe.
We'd like to appreciate your time. Thank you so much, Dr. David Ajibade, General Practitioner, Executive Director, Brain and Body Foundation. Thank you for joining us.
Thanks.
We have more on the COVID-19 updates when we return. Please stay with us. Over in Niger State, the state's task force on COVID-19 is taking more measures to tackle the compliance challenge. Here's our correspondent, Emperor Simon, as he brings us this update.
Since the relaxation of lockdown in Niger State by Governor Abubakar Bello, we've seen a spike in the number of confirmed cases of COVID-19. From 44 as at 9th of June. Today, Niger State has a total of 122 confirmed cases of COVID-19 with 7 deaths. We spoke with the chairman of the Niger State Task Force on COVID-19, who is also the secretary to the state government, on whether the government is considering returning to a total lockdown. But he says that may not happen.
What we focus on are 2 things or 3. 1, we will insist and enforce the use of face mask. In fact, when we commence, it does not matter whether you are walking on the street, or on your foot, or riding a motorcycle, or driving your car. You must wear a face mask. I mean, that is one of the first, line of the first measure we're going to take. The second one, of course, will enforce social distancing, especially while we're going to have, while we have, ceremonies. Even if it's less than 20, has been, prescribed, there must be, exercise of, this, social distancing. In our churches, in our mosques, we'll continue to, sensitize and educate people the need for them to comply with with that measure of social distancing. The third one, of course, and this is a clear directive from His Excellency, the Executive Governor, that our borders, would remain closed and will intensify enforcement. And we're happy that I think federal government is also contemplating about really reinforcing interstate movement, so that way we don't have carriers or infected persons moving from one state, into another. And I think it will be a welcome development, and we're going to align, with that.
People here are even afraid that there could be even worse cases if the government does not take the necessary step to curb the spread of COVID-19. From Niger State, Emperor Simon for COVID-19 update.
Let's talk more about managing COVID-19. We have Dr. Oluwatoyin Ojo. She's also a pharmacist. She joins us here in Lagos. Glad you could join us on the program.
Thank you for having me.
Okay, let's start with what the World Health Organization has done, especially with regards to treatment or the search for vaccine, and that's stopping clinical trials for hydroxychloroquine. We remember initially they suspended it and they started again, and now they've totally, stopped clinical trials. What's your take, and is there a reason for us in Nigeria? We know Lagos State talked about clinical trials for hydroxychloroquine. Is there a reason for us to continue even with the World Health Organization's decision?
Yeah. Well, if we have been conversant with the conversations in this regard, you find a lot of back and forth conversations, and WHO coming to withdraw and then eventually kind of change that decision and get into the trial again. So for me, with their latest decision to halt hydroxychloroquine and chloroquine trials, I would say that Nigeria should continue. And my reasons are, for us in Nigeria, we have had data on safe use of those 2 molecules for a lot of indications aside from COVID-19. We have used chloroquine and hydroxychloroquine for management of malaria, and we have had success. We have had usage in amoebic abscess. We have had usage for some autoimmune diseases like lupus erythematosus. So coming to talk about its use in COVID-19 is a repurposing. So for us, I think that we should continue. Also, there's this WHO incidence data that was correlated with areas that you have malaria endemicity, and there was this outcome of that data saying that areas where you have high endemicity for malaria, you find low levels of the pandemic
COVID-19.
For COVID-19. So, and that suggests there's some kind of beneficial effects that comes, from those regions where they have had previous usage of chloroquine and hydroxychloroquine in managing other indications. So, it is important for us to be able to establish those claims, and the only way we can do it is by conducting those clinical trials. And then you also find that for hydroxychloroquine and chloroquine, you discover that the usage in those trials in other climes had to do with more severe cases of presentation of COVID-19. But it's been said from research that hydroxychloroquine and chloroquine would find more usage in early introduction, so the early stages of COVID-19. And you find most of those cases being the prevalence in Nigeria. You find mild to moderate cases. Our mortality has been as low as 2.5%. So I think it's important. And then when you also consider that we haven't found a lot of clinical trials going on, in the local content for us in Nigeria and Africa, and it's important that we develop our medications based on our data. It's time we started using our data. So for me, I am for a lot more clinical trials going on in Nigeria and in the African region, because you discover that our genomics are quite different from our peculiarities in terms of our genetics, our nature, our nurture, our exposures, our lifestyle is different from other clients.
But not necessarily the strain of COVID-19.
No, even with the strain of COVID-19, it's possible that we have similar strains, and then it's even possible that our strain of COVID-19 is different. So it is in the place of research that we're able to establish these findings, and then that helps us to be able to come out with definite, statements of usage, of usefulness in terms of therapeutic outcomes to expect from using this medication. So I am for it.
All right, we'd like to thank you. Hope to have you again, Dr. Oluwatoyin Ojo, a doctor and also a pharmacist. Thank you for joining us on the program.
Thank you so much for having me.
Melbourne and a rural area in regional Victoria are to re-enter lockdown from Thursday. This is according to the state's Premier, Daniel Andrews, who says the order will last for 6 weeks. Australia's second biggest city has seen a surge in cases in the past few weeks. It recorded 191 new infections today. That's a daily tally record.
Lockdown measures will be reimposed in Australia's second largest city. Victorian Premier Daniel Andrews said on Tuesday, confining Melbourne residents to their homes unless undertaking essential business for 6 weeks as officials scramble to contain the coronavirus outbreak.
All of those metropolitan local government areas, plus Mitchell Shire, will be the subject of the stay-at-home order from midnight tomorrow night. Those 4 reasons, which are well known, they will extend to each and every person across the metropolitan area. Stay at home means just that. Not stay at your holiday home, not stay at your second home. Your principal place of residence is where you must be, except for the 4 reasons to leave your home. This is, I know, further than we went last time, but we are in many respects in a more precarious, challenging and potentially tragic position now than we were some months ago.
The decision, which affects around 4.9 million people, was announced just hours before the busy border between Victoria and New South Wales is scheduled to close for the first time in a century. Pakistani Prime Minister Imran Khan has handed over the first batch of a dozen locally manufactured ventilators to the country's National Disaster Management Authority in the northwestern city of Haripur. It comes amid a growing demand for ventilators and other essential medical equipment in the country. The first round of ventilators, called SafeVent SP100, were produced by the National Radio and Telecommunication Corporation. And Brazilian President Jair Bolsonaro has taken another COVID-19 test after reportedly having a high temperature. Bolsonaro said his lungs had also been checked and they were fine. The result of the COVID-19 test is expected on Tuesday, as he has cancelled all engagements. This is the 4th time the president has taken a COVID-19 test. All the other tests have been negative. He has previously downplayed the virus, comparing it to a little flu, as his country has the second highest number of cases and deaths in the world.
Stay healthy, stay safe, take responsibility. It's the message from the Nigeria Center for Disease Control. Their website comes alive with updates on the regulations, COVID-19 regulations and guidelines. You can see all the information, statistics, cases across states. It says that every new case is motivation to keep pushing, and each recovery is proof that we can get through this together. The World Health Organization also has live updates. You can take a look at some of the cases and the strategies. Our website, channelstv.com, has the latest news. All you need to do is log on, news there at your fingertips, channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now.